Hello, and how are you? My name is Winnie Berawa. Welcome to my session on the Kenya National School Health Policy, Part 1. This is a document that was developed in Kenya in 2018 to guide schools and the Ministry of Health on developing of the school health or running of the school health programs in the different levels of schools in Kenya. And if you're new here, this is a channel that focuses on lectures, notes, and expert interviews related to healthcare. Remember to subscribe and click on the notification button. Now, the Kenya School Health Policy or the Kenya National School Health Policy, being a document that tells you it's a bit bulky, and while I was doing the review and expose of this document, I put it into three parts. So we have the first part, which will look into introduction. Second part that will look more into the thematic areas that the document focuses on. And the third part of part 3 will look more into how the implementation of this policy should go through. So ensure you go through all the parts so that you can understand how this document comes into completion. So let's start with the first part. So the first part by introduction is that the health policy, the national health policy aims to improve health status of school children by addressing related to issues such as equity, okay, and improvement of learning environment for both genders, including children with special needs, that these children can have optimal performances in their education. So when this policy was developed, the main agenda was to ensure that at least the health status of children has been addressed and these children are taking advantage of equity and are having a very good learning environment, including for both genders, and ensuring that things related to special needs are also catered for. And so to get a proper document, it was guided by several other documents or rights that were employed from the Sustainable Development Goal. We have the Kenyan Constitution 2010. It was also guided by the Vision 2030 document of Kenya. We have the Basic Education Act 2013, and also we have the Children Act, among other legal frameworks in Kenya. So remember, as we develop a policy, we are developing a document that will guide or will provide a route that we can use in understanding how to handle school environment or how to handle health-related status while children are learning in schools. So the rights of the students while developing this policy were guided by these other documents in these five areas: SDGs, Kenyan Constitution, Vision 2030, Basic Education Act, and the Children Act. So picking in, what does this policy seek to do? So the policy seeks to actually reduce the impact of both communicable and non-communicable diseases. The other bit is the policy seeks to enhance values and life skills among the learners. The policy targets also improving wash facilities as well as the school infrastructure. So it has aspect of wash facilities. This is water, sanitation and hygiene in the schools, but also looking at school infrastructure in terms of physical environment and the outside environment, ecological and so on. Other bit is the policy is looking into meeting the diverse nutrition and special needs of learners and also to mainstream gender issues in our education and health system. So this policy is a bit comprehensive. It's not just looking at health in general, but it has tried to break it down into aspects that we will later see under the thematic areas as the areas of focus that will ensure that children adequately acquire and learn in the schools. So this will vary from reduction of communicable and non-communicable diseases, enhancement of values and life skills, improvement of wash facilities, improvement of the school infrastructure, meeting the diverse nutrition and special needs of the learners. So that's the literally what you can say like the main target of the National School Health Policy of Kenya. Then we have the policy rationale. Rationale means why is it in place? It answers the why do we have this policy. So this policy provides an organized structure that is conducive for provision of health and social services that are very key for disease prevention and control. So in the schools, we know that there are health needs for our children or for children. And for these health needs, we also have nutrition services. And part of the reasons why the policy exists is to meet these needs or to provide the nutrition services. The other bit is it's to either promote health but also accelerate spread of ill health in the environment. Remember, if a policy is not well formulated, it can have either effects. If you have a good policy in place, then we'll have good health. If you have a bad policy in place, then you'll have policies that are spreading ill health and poor performances. And therefore, schools are seen as part of the ideal settings that can be good for implementation of health program and as a result are known for promotion of health. So with good policies in place, then we are assured of promoting good health status in our children and in the community as a whole. Remember, once we say that whatever is taught in our children while in their classroom is what actually gets transferred to the community in terms of knowledge transfer, not only at the family level, but also in the community in general. So good policies promote good health, and bad policies accelerate bad health or ill health in our communities. So what principles guided the Kenya school health policy? We've said that the rights that are catered for in this policy were generated from the five areas: Vision 2030, Sustainable Development Goals, the Kenyan Constitution, the Children Act, and all that. But now there are certain principles that a policy needs to be guided on, and some of this policy includes the policy needs to ensure that it's guided by the principles of access to health and nutrition services. This policy also was guided by the principles on access to water, sanitation, and hygiene. We also have the other areas on access to education, that is a right to every child, equity, equality, and non-discrimination of the children against illnesses, against gender, sex, age, and so on. There's also ensuring access to information. Every child has an access to information, fully furnished libraries, good learning environment, good teachers, because these are ways of accessing information. Ensuring that there is equity. Okay. Other principles includes children having access to privacy and confidentiality, learners' safety in schools, other principles in the gender responsiveness and transformative approaches, partnerships, ensuring that schools are working in partnership with international organizations, community programs or community groups, partners and other stakeholders to ensuring that there's effective school programs, to ensuring that learners are kept healthy. There's access to proper school physical facilities and infrastructures that are safe enough for the children. And the other bit is child participation, that every child is given an opportunity to participate while in their school environment. The other bit is on the policy objectives. And here we are looking at what is the objective of the policy. So the objective of the policy is mainly to ensure that there's a sustainable school health program, that every school in Kenya has an opportunity to run a school health program or to have school health program. The other bit is the policy ensures coordination of the school health intervention by the relevant ministries, and that is Ministry of Health and the Ministry of Education. It has also other stakeholders such as the non-state actors, learners themselves, and the community members. The policy objective was to also ensure there's effective school health monitoring and evaluation system. So when you're looking at this national health policy, we're not just looking at a policy that cuts once and for all. It has objectives, it has rationales, it has targets, it has vision and missions. And under the objectives, there's the aspect that the main thing was to ensure the health programs are sustainable in school. There's enhanced coordination by the relevant ministry, and the main ones, the Ministry of Health and the Ministry of Education. And the policy objectives is to ensure that there's effective monitoring and evaluation in the school health program. So those are the main parts. policy strategies. These are the approaches that the policy will check onto to ensure that the school policy is in place or is being implemented in the different levels of school. So the policy strategy number one was leveraging on existing program relating to school health. There's also advocacy, communication, and social mobilization, commonly known as SCSM, mainly for improved health. The other policy strategies was maximizing utilization of resource allocation, both at national and devolved government towards school health. In other words, the policy was ensuring that there's enough resources at the different levels to ensure that there's funding for the school health projects. The other bit of policy strategy was to ensure participation of all stakeholders, and this was to ensure the sustainability at the different stages of the program. The policy was to also have intersectional coordination approach. Intersectional coordination approach is whereby every needed ministry has been included or has been put into place to work together. There's also evidence-based interventions. The strategy was to have monitoring and evaluation for the policies. And the other bit was aligning implementation to the existing legal and policy frameworks that is relating to school health in Kenya. So with these strategies in place, looking from leverage, advocacy, resource allocation, stakeholder participation, intersectoral coordination, monitoring and evaluation to legal framework was to all help us have in place and ensure that the policy have been implemented adequately. Looking at the last bit, that is policy vision, mission, and goal, because I told you the policy has a vision, a mission, and a goal. So the vision of the policy is to ensure that there is healthy, enlightened, and productive learners in the community. The mission of the policy was to enhance coordination in planning, designing, and implementation of sustainable quality health intervention in the basic education levels in Kenya. And lastly, the goal was to ensure a healthy, safe, and friendly environment for all learners in Kenya. Remember, this is a policy developed just for the Kenyan school. So the vision, the mission, and the goal all looking towards productive learning for the students or learners. But again, the different portions. So the mission is a bit elaborate and detailed because it's looking at coordination, that is planning, designing, and implementation, while the goal is looking at safe and friendly environment for all learners. And that finishes part one of our school health policy, where we already said we're going to do this into three parts. And this is the introduction part. We've seen the rationale, the objectives, we've seen the strategies, we've seen the mission, vision, and the goals, and we've seen the definition of what the policy is and what guides it. So if this is your content that you like, remember to subscribe, comment, and share with your fellow students and other stakeholders. And until we meet again, bye-bye.